there, I'm Olivia. I'm going to be your nurse today. I'm just going to perform some hand hygiene before we get started. Can I have your name and your date of birth? Okay, great. Let me just check your bracelet. Okay, and it matches your health record. Do you have any allergies? Okay. So today I'm going to be performing a physical assessment. Is that okay? Okay, so we're going to be assessing your cardiac, respiratory, gastrointestinal, and mental states. To do that, I'm going to be oscillating, which is listening with my stethoscope, inspecting, percussing, and palpating, which is a series of touch assessment. Are you ready to begin? Okay, can I have your name again? And do you know where we are today? And what day of the week is it? Okay. Have you been experiencing any feelings of hopelessness or depression? What about nervousness or anxiousness? Okay. How often do you drink alcohol? Do you use drugs or smoke? Okay. How frequently do you exercise? Okay. A great way to boost your cardiovascular endurance is to exercise 30 minutes a day, 5 times a week. That can include running, walking, swimming, cycling. I'm going to ask you to remember 4 words: pizza, candy, straw, and ring. We're ready to move on to the cardiac portion. Does your family have any history of any cardiac issues, hypertension, things like that? Okay, and we're going to start with your vital signs. So I'm going to put this pulse oximeter on your finger. Take your temperature, blood pressure. Temperature is 98.4, that's great. Pulse oximeter says 99. Okay, I'm just feeling for your radial pulse. Okay, your radial pulse is 70 beats per minute, and your blood pressure is 90/60. Okay. So you're breathing at 16 breaths per minute and the chest is moving bilaterally. That's great. So I'm just going to assess your jugular veins for any distension. So just look to your left. And again, look to your right. Okay, and I'm just going to assess your eyelid. So I'm just going to pull it down. Okay, good. It looks pink and moist. So next I'm just going to be assessing your pulse. So I'm going to start with the carotid, brachial, radial, femoral, popliteal, tibial, and your pedal. Okay, next I'm just going to listen to those pulses that I just found. Carotid, brachial, radial, femoral, popliteal, tibial, and pedal. Okay, I'm just going to assess for capillary refill. Good, less than 2 seconds. Same thing in your toes. Okay, so I'm just going to palpate under your left breast for thrill or vibration under your PMI. Okay. And I'm just going to assess your skin for the color, any tinting, temperature feels great, all of that's normal. So next I'm going to listen to the 5 heart sounds. So aortic, pulmonic, Erb's point, tricuspid, and apical. Great. So next we're going to move on to the gastrointestinal portion. So I'm just going to have you lay back. I'm going to lift up your shirt. So I'm going to listen to your bowel sounds. Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. Okay, so next I'm just going to feel these. So just let me know if you have any tenderness. Now I'm percussing. Okay, I'm just going to have you lift your neck up a little bit and check for hernias. Okay, everything looks great and it's symmetrical. Just going to document those findings. So next we're going to be moving on to the respiratory portion, so you can sit back up. Do you ever have any pain or trouble breathing? Okay. So like I said before, you're breathing at 16 breaths per minute. Chest is moving equally, which is really good. So I'm just going to have you take a nice deep breath. Okay. And I'm just going to listen to your lungs. So deep breath. Good. Deep breath when I move the stethoscope. Okay, and I'm just going to be percussing those same areas in the same pattern. Okay, great. There was no tenderness when I was doing that assessment, right? No? Okay. So I'm just going to do the same thing, but on your back side. So I'm just going to have you cross your arms so I can get a better listen at the lung tissue. Deep breath, deep breath. Okay, and same exact thing. I'm going to be percussing, so listen to the lung tissue. Excellent. So next I'm just going to have you take a deep breath. I'm going to check for your expansion. Good. Okay, and you can sit back up. So we're finished with those assessments. Can you recall the words that I asked you to remember in the beginning? Okay, great. Do you have any questions for me? All right, it was nice to meet you. The doctor